She logged 2,318 new COVID-19 cases on Sunday. This is the third straight day that fresh cases have been below the 3,000 mark. The number of currently ill people have also gone down for the third straight day. From over 31,000 last week, active cases are down to 28,000 yesterday. The COVID-19 positivity rate, or the number of people test positive among all those tested, is now at 14.1%. That's slightly below the 14.3% positivity rate for the past 3 days. The OCTA Research Group says the 7-day average of new cases in the country is down by 15% from the previous week. If current trends hold, OCTA projects cases per day could go below 1,000 per day in the middle of September and less than 500 per day by the end of September. We now talk to the OCTA Research Group. Joining us now live via Zoom is Dr. Guido. Good morning, Professor. Thanks for joining us. Recent data from OCTA show COVID-19 cases in the country dropping below 3,000 per day. Do you see this downward trend continuing until September? And what's your projection in terms of cases per day? 500 or less, because that's what you tweeted over the weekend.
Yes, Elias, good morning and happy Monday. Thank you for having me. You're correct. We have been seeing a decline in cases. Now, trends are not irreversible, so it can reverse anytime. But at least with the current downward trend, the reproduction number has decreased to 0.89. In fact, it's a little lower than when I tweeted it. And the growth rate is down to negative 19%. So what this means is that cases have been decreasing over the past 2 weeks. So with that, when we project it, we're sort of expecting, or at least the projections show around 1,000 or perhaps less than 1,000 cases by mid-September. And hopefully by the end of September, we'll see less than 500 cases a day in the whole Philippines. I mean, we're hoping those trends will hold, of course. Like I mentioned, it's not irreversible because we have face-to-face classes, which could cause upticks in cases is possible, but we'll have to see about that.
That's exactly why I'm curious, Dr. David, because just last week, students returned to classes face-to-face, and your forecast projections are actually very optimistic. We're coming from a place like 3,000 cases per day, and in a month's time, it's going down to be just a fraction of that. I mean, how soon? I mean, what are the factors that are causing the decline in cases, and why could the Philippines bring down the cases that soon? What are we doing right?
Well, to be honest, Lois, it's actually, it hasn't been soon. In fact, this wave has lasted a lot longer than we expected it to. Initially, when it started in June, we thought it would be a 2-month wave and it would be done before August. And that's based on the experience of South Africa. But in fact, it has lasted a lot longer. And, some factors why it lasted longer, we believe, are that, the subvariants came in here, multiple subvariants. And then the factor of that immunity has been waning. This includes not just vaccine-induced immunity, but also natural immunity from exposure. So we think that those are contributing. Now that we're building again, rebuilding our wall of immunity, cases have been decreasing. And yes, this downward trend that we're projecting does not factor in the face-to-face classes. It could still continue to go downward. Maybe it's somewhat optimistic. But at the same time, we have to be realistic that classes could, face-to-face classes could bring about spikes. And it only started, I think, last week. And, it may take us about 2 weeks before we see the effects. At least 2 weeks before we see the effects of face-to-face classes.
Right. You talked about immunity, and we know for a fact that just about 20% of the student population are vaccinated, right? And you also talk about subvariants. So can you talk about the expected natural character of the virus? Would that have something to do with, the decline in cases, and given the fact that only 20% of the student population are immune or with vaccinated?
Yeah, well, that's of course a concern. Now, the number of vaccinated is not necessarily correlated with I mean, it's somewhat correlated, but it does not reflect the number of those with antibodies, because some children may have gotten antibodies from natural exposure. When they conducted a serology survey in the UK, they noted that about 99% of high school students in the UK had antibodies, and about 73% at that time had antibodies. I mean, these were 73% of elementary students. I would have loved to see a similar serology study in the Philippines, so we can see if substantially more children have antibodies than those who are just vaccinated. And well, the thing is that, Lois, that most children who catch COVID will see presentations of mild to perhaps or even asymptomatic, and
Professor.
that will likely be the case. But of course, there will still be some more serious cases, moderate cases. So that's why we're not saying that we're out of the woods yet, or that we could relax health protocols. What we're saying is that these projections will hold if we continue to do the same thing, or following minimum public health standards, and
Yes,
getting
Professor.
ourselves protected.
So we're not out of the woods yet. That brings me to our last question. You have September projections. Now, what about for the rest of the Burr months? What are your projections, Professor?
Well, once it gets down to 500 cases per day, Lois, and hopefully it happens. Like I said, this is not guaranteed. It's still reversible. It should be much lower by the ends of October, by October, by November, by December. So hopefully, with no new subvariants, even if we have spikes in cases that could happen along the way, hopefully we'll have a very Merry Christmas this time around again.
Well, thank you very much, OCTA Research Fellow Dr. Guido David.